I'm an ICU nurse. I've been caring for critically ill patients either as an advanced life support medic in the back of an ambulance or in a hospital for 21 years. In addition to taking care of critically ill patients in a 32-bed medical surgical trauma ICU at a level 2 trauma center, I'm also a trauma nurse core course instructor, an advanced cardiovascular life support instructor, a CPR instructor, and of course an EZ-IO instructor. Many times I was finding our patients had inadequate vascular access, especially in cardiac arrest. And American Heart Association guidelines for advanced cardiovascular life support are that if you do not have IV access, you should be getting IO. We didn't have that. And so I went to my director and said, we need to have this. And she approved it. In my ICU, we've used EZ-IO for many different reasons. Our top 3 reasons are cardiac arrest, hypotension, sepsis, and respiratory failure. But we've also used it for many other things: traumatic brain injury, opioid overdose, GI bleeds, and trauma. In my ICU, we've had tremendous success with EZ-IO. In the last 4 years, I've had 61 nurses and 1 physician place 155 IOs and 123 patients for 22 different medical reasons. We have a 90% first-time successful placement rate. We've had 0 infections, 0 serious complications, and I have nurses coming up to me and saying, I want to put the next one in. It's our policy and procedure that for every cardiac arrest and every rapid response, that the ICU nurses bring it on those responses. So all of our ICUs in our 2 campuses have EZ-IO, and it's routinely brought with us on cardiac arrest and rapid responses. The very first time I used EZ-IO, we had a patient. I was walking past the room and I noticed that his central line looked odd, and I said something to his nurse and she came running out and said, Rob, the central line is coming out. And this patient was on the ventilator, on 3 different pressors, on maximum life support, and we'd just been cleared to use EZ-IO, but I didn't have the equipment, so I sent another nurse down to the emergency department to bring the equipment back to me. We put all the medications the patient was getting into that tibial IO, but because the patient hadn't been getting everything he needed, the patient began to brady down and went into cardiac arrest. We used the IO to successfully resuscitate the patient, get the patient stable, and then a physician was able to come in and place the full barrier precaution central line. EZ-IO gives me the ability to have immediate vascular access. I tell people all the time that I can insert an IO in you faster than I can tie a tourniquet on you to place an IV. What makes me so passionate about EZ-IO is that it gives me a tool immediately in my hand that I can deliver life-saving medications and fluids to my patients right away. And I would never want to practice again without that available as a tool to me. My name is Rob. I'm an ICU nurse, and I'm in.